on to the next topic here, which is, I think, something that everybody's very interested in. If you do any search about joint pain on the internet, you'll see a tremendous number of ads for biological and regenerative medicine type of treatments. We are very lucky here to have a very experienced person who can talk about the advancing area of regenerative medicine with some authority. Dr. Christopher Rogers is here in San Diego. He's a professor at the university. He's also uniquely qualified because he's one of the few people in the world who is board certified in regenerative medicine. So he's going to tell you about stem cells, where they are, what they can do for our treatment, as well as for our pain. Dr. Rogers.
Thank you, Raj. I appreciate that. So I'm a physiatrist by training. I've been practicing for almost 25 years now, and I've learned as a non-surgeon that actually hip and knee replacement surgery are excellent forms of therapy for people who need them. And many times patients will come to me wanting a non-surgical approach, and after I evaluate them, I feel that maybe surgery is a better option for them, and so they're a little surprised when I share that. However, I'm getting more and more questions now about regenerative medicine, and that's because I've started exploring regenerative medicine maybe 8 years ago now. And first of all, what is regenerative medicine? Regenerative medicine is an exciting new field because it really is a deep understanding of how the body heals itself. And it does this, of course, through cells and how the cells communicate with each other with various molecules. And so the more we understand how these mechanisms work, the more we can develop new treatment options to modify the disease process. As you just heard, arthritis is actually a very complicated disease. In the case of knee or hip arthritis, often there's a chronic low-level inflammation of the joint. And that is often the primary cause of pain. For example, it was always surprising to me how a patient would bring a very severe arthritic condition with an x-ray showing bone-on-bone changes, and yet you put a little cortisone in the knee and they feel great. Why? We didn't grow any cartilage back. We actually just modulated the inflammation in the joint. So then we thought, well, what if we could do that for more than just a couple of weeks or a couple of months? And that's what regenerative medicine at this point promises. In the future, it promises even more potent restoration of the joint. So I'd like to just review some of the science behind this. First of all, in our first slide, we realize that we have 30 million Americans and many more across the world who are suffering with osteoarthritis currently. In the United States, we have about 1 million or so joint replacements performed, which means that the vast majority of people are trying to find a way to manage their pain and problems with function by non-surgical means. So my job as a physical medicine doctor and regenerative medicine doctor is to find the best treatment options for those patients. Some patients are not quite ready for surgery yet. Their arthritis may not be that severe. They may be too young. We know that joint replacement in the very young maybe is not as good as people who are more in their 60s or 70s. They may be too old. They may be in their 80s or 90s. We have patients in their 90s who are wanting to be active. Or they may not be medically fit for surgery. So these were some of the patients that I first started treating with, using regenerative medicine to treat, and was pleasantly surprised by the results. So in regenerative medicine, we talk about using cells to restore the joint, to modulate inflammation. So on the next slide, we show that there are a couple different ways we can do that. One is we can use cells from your blood called platelets. And you may have heard of something called PRP, which stands for platelet-rich plasma. So when platelet-rich plasma first came out in the orthopedic community about 10 or 12 years ago, it was really not regarded as a legitimate option. However, at this point, we can say we have several level 1 evidence studies that show that PRP is extremely effective for mild to moderate arthritis. And patients can get significant relief for sometimes more than a year from a single injection. PRP involves using cells in your blood which can modulate inflammation and stimulate changes in the cartilage that make that cartilage function better. For patients who have more severe degenerative changes, cells called stem cells have been shown to be very effective. Now, what constitutes stem cell therapy? Technically, currently, there is no true stem cell therapy. A stem cell therapy would involve removing a cell from the body, concentrating it, isolating it, and then re-injecting it into the patient. Currently, what is, at least in the United States, allowed or regulated by the Food and Drug Administration would be correctly called a tissue transplant. And what kind of tissues do we use? We use bone marrow tissue, or we use adipose tissue, which is fat underneath the skin. I was as surprised as you are to know that fat actually played a positive role in orthopedic medicine. So it turns out that in 2001 at UCLA, some doctors discovered that stem cells, which had previously been discovered in bone marrow, were also present in the fat. And so by removing these tissues and concentrating them, we could then re-inject them into injured joints or tendons or ligaments and see a beneficial healing response in those tissues. So then the next question is, well, how beneficial are they? Are we just talking about a temporary fix, or are we talking maybe a long-term cure? Well, one of the most impressive studies that I've seen recently published was published by one of my mentors, Dr. Philippe Hernigot, who's an orthopedic surgeon in Paris, France. And Dr. Hernigot has been using bone marrow-derived stem cells for almost 30 years. And he has a population of patients aged very young, 20 to 40 years of age, who have developed what's called avascular necrosis, as you heard earlier, a dysfunction of the bone marrow, which leads to severe degeneration of the joint. And these patients at a very young age are now looking at total joint replacement, which is the standard of care for severe degenerative change with avascular necrosis. He performed this study as an orthopedic surgeon with his patients who had bilateral, both knees, severe osteoarthritis. One knee was joint replacement surgery was performed, and the other knee he injected stem cells from that patient's own bone marrow. And he followed these patients for 12 years. And what he learned is that the improvement on the operated knee was just as good as the improvement in the cell-treated knee. So this is very exciting, and new studies will have to validate his findings, but the point is that some positive strides have been made. Now, what constitutes cell therapy, and what is not cell therapy? So at this point, we're using a patient's own cells, their bone marrow or their fat, or their blood in the case of platelets, to attempt some regeneration of the joint. At this point, we are not using what's often advertised, umbilical cord blood or placental tissue or amniotic fluid. And the reason why these tissues are not used typically as a stem cell source is because they have not been tested for safety and they've not been tested for effectiveness. And so a lot of the claims that we're seeing advertised are really unsubstantiated until further studies are performed on those products. But at this time, we've been very encouraged by the results. In our clinic, we've been seeing patients, even with severe end-stage joint degeneration, achieving very good results. We've been following those results for several years, and the key is to be publishing those results. So how would you find a doctor who actually can apply the right kind of protocol for you? On this last slide, I list the key things that you should look for in your physician. First, are they board certified in regenerative medicine? This is a new field. There are maybe 150 of us around the planet right now. There will be more. They will be training physicians in residency programs and medical schools, but at this point, physicians have to get special training after formal training to develop these skills and knowledge set. Second, is your physician board certified in some orthopedic field, either orthopedic surgery, physical medicine, or sports medicine? A lot of times we see physicians wanting to offer cell therapy, but they don't have that basic background to know how to manage all the other aspects of musculoskeletal medicine. Third, are those physicians using an FDA-compliant source of tissue? Finally, do they have advanced training in the use of what we call interventional orthopedics, using ultrasound or fluoroscopy to guide these injections? And then finally, are they actually tracking their outcomes, and are they publishing or presenting their findings in medical conferences and medical journals? So those are the things I think you should look for. The American Academy and Board of Regenerative Medicine has a website. You can find them, and there's a lot of good information on that site.